Hello, everyone. I'm Ron Rolfing, your host of the ACAP Preferred Education Series, and I'd like to welcome you to our latest session presented by the Catalyst Solutions team. And they will be discussing real-world AI solutions for the C-suite, a financial lifeline for Medicaid health plans. But before I turn it over, I have a few housekeeping items I need to take care of. This webinar, along with all ACAP calls and webinars, will be held in accordance with the ACAP antitrust guidelines, and these guidelines can be viewed on our website. We will be recording today's call, and for our ACAP plans, we will post the slide deck and recording on our website by tomorrow morning. And the link to these items can be found in the invitation sent to you for this webinar. And please remember, if your ACAP plan is looking for a vendor, be sure to check out our list of preferred vendors on our website. Just look to the top of our homepage and click on the preferred vendors link. And while you're there, you can post an inquiry on RFI or an RFP on the preferred vendor connection portal. And of course, during today's session, you can ask a question at any time by clicking the Q&A icon in your Zoom window and typing in your question. Now, I'll pass it over to Sas to get things started.
Thank you, Ron. I see we're still trickling in attendees, but in the interest of time, we'll get started. Thank you for attending this webinar. In today's challenging financial environment, we believe AI isn't just a tech trend, it's a strategic lever. So we'll share some real-world examples of how to unlock its full potential as a scalable, secure solution that delivers where Medicaid plans especially need it most. We will try to cut through the noise of disconnected one-off AI solutions, which all of us have been hit up with. In this session, we'll explore how leading Medicaid health plans are implementing enterprise-wide AI strategies that deliver measurable financial and operational impact. We have also invited a partner in our AI journey, healthplans.ai. Kevin, you can move to the next slide. Yeah, and by way of introduction, I'm Sas Mukherjee, President of Catalyst Solutions. Before joining Catalyst Solutions in 2023, I was a CFO at Gainwell Technologies. Some of you may know Gainwell. We're the fiscal agent and claims processing platform and services for majority of the state Medicaid program delivery. In prior life, I've been a divisional CFO and head of strategy at Kaiser Permanente. I've been a CEO at a global BPO service delivery company, managed care TPA, and also managing director at a couple of Big Four consulting companies. My entire career has been in services, healthcare, and technology-enabled transformation. Joseph, would you like to introduce yourself?
Sure, Sas. Thank you. And I'm Joseph Ansel, the co-founder and chief AI officer at healthplans.ai. Have around 3 decades of healthcare business technology experience. Formerly have run multiple P&L with global system integrators. And most recently, before joining here, was a chief procurement officer at Gainwell Technologies.
Very good. We can go to the next slide. Let me just quickly introduce the agenda. Just context setting. All of you have experience on what health plans are going through, but we'll just make sure we have a context setting and get everyone on the same page. How do we solve these problems? And this is where we'll bring in Joseph to talk about few use cases that we have jointly worked on and solved. We'll talk a little bit about the strategies for a successful AI implementation. I'll try to share some best practices as we have been working on this. And then we'll have time for Q&A. And then stick around. There is a nice gift at the end from Health Plans. So let's move to the next slide. And just to set context in terms of what Catalyst does, so you can understand better where we are coming from. Catalyst Solutions has been serving over 20 million Medicaid and Medicare Advantage members, and 200 plus health plans of all sizes and lines of business for the past 26 years since our founding. And we are a woman-founded and owned US-based company with presence in 48 states. Our key offering is what we call Catalyze. It's basically a solution framework that leverages people, process, and technology to help deliver better health outcomes, superior member experience, strategic provider engagement, all resulting in reduced cost, both administrative and improved medical loss ratios. While we are not a health plan, however, based on being a strategic partner to a lot of health plans, in an aggregate, we are processing transactions on behalf of those plans, and our scale is similar to a medium-sized health plan. So when we are able to solve some of the problems faced by us, we are also solving them for health plans. I won't spend too much time on this page because I don't think I have to explain why health plans are at crossroads. We could probably talk about this the entire session and still only scratch the surface. Instead, I'll just spend a moment on to highlight a few of the challenges. Hopefully all of you will agree that there has been an increasing trend of utilization with a aging population, delayed care due to COVID, which is also creating higher severity of disease. So it's a double whammy. Both higher utilization as well as severity of disease is much higher. A lot of unfunded and time-bound regulatory and compliance mandates. And now with the new administration, and there's a lot of uncertainty, less uncertainty now than it was before, but what lies ahead for programs such as Medicare Advantage and Medicaid, as well as ACA, will likely be massive change any way we look at it. And at an operational level, the industry has been weighed down by antiquated systems, a fragmented environment of partners, as well as interoperability issues. So, Kevin, if we can move to the next slide. Again, I mean, there is obviously a lot of hype around AI. And when I speak with industry leaders, there is some level of ambivalence about AI. Many are still trying to figure out if it is real and can deliver tangible benefits, or is it just the next shiny object? So I wanted to take a moment to explain our thinking as we leveraged AI. I think at a high level, any health plan executive would hopefully agree with the business goals, right, that we are showing here in terms of better health outcomes for their members, delivering superior member experience, strategic provider engagement, but doing so while reducing costs, both administrative as well as medical loss ratio improvement. But in order to achieve these goals, we have leveraged many transformation levers. Obviously, talent, a lot of healthcare is delivered by individual acts of heroism. The industry has resorted to the advice and counsel of consultants to both guide and help manage transformation. Over the past decades, significant parts of operation that can be delivered less expensively from offshore locations or delivered better by an outsourced service provider have already been outsourced or offshored. Automation is a continuing transformation lever we use. Also, there's an aging and expensive technology platform that has also been used. However, when we think about the size of the expected change we will have to deliver to not just survive, but to be ready for the additional changes that are anticipated in the near future, we felt we needed something more than the traditional transformation levers. This is where we tried AI. We've been working with healthplans.ai as a partner for the past 15 to 18 months, even as they were in a stealth mode. bringing our use cases with some of the biggest challenges or opportunities, coupled with knowledge of AI, to find some tangible benefits. Having been a CFO in the past, I like transformation levers that are fast and inexpensive, yet deliver high measurable benefits. Enter AI. So Kevin, if you move to the next slide. So the question we had was, can we really solve these challenges? None of these challenges are unique or will sound new to you, but how can we solve these challenges? And can AI be the solution to any of these problems? So I'll have Joseph talk about some of the specific use cases and how we went about it. Again, we are not presenting anything here that we haven't tried ourselves and seen benefits. So these are real use cases. Joseph, do you want to take us through some of those?
Absolutely. So, so Sas, thank you for setting that up. You asked the question, can AI solve for some of these challenges? The answer is yes, we definitely can. So if you look at what you mentioned out there as goals for health plans, right? If you go from the top left-hand side to all the way, from an outcome basis, you want to promote better health outcomes. And how do you do that? Everything else around it is important, which is providing better member experience, promoting better provider experience, reducing costs, stay in compliance. To level set this, healthplans.ai North Star is to drive, and we consider several levers, and some of the levers have already been mentioned here. Our AI aligns directly to all of these outcomes. Outcomes improve when management and the engagement rises and quality processes are consistent, which in turn increases the stars ratings. Like, for example, in the better health outcomes, we definitely want to see an increase in star ratings because that's directly correlated to the health outcomes. For members like chatbots or natural language processing that answer questions, fast and personalized outreach, and that keeps people engaged before any problems can occur. So these are all some of the things that we have seen which work very well. In fact, from the customer service perspective and the chatbots and the natural language processing, we have seen in the last 24 to 36 months, we have seen a significant improvement and clarity in the voice-based contact centers. Talking about, better provider experience. How about data management of the providers, real-time payment estimates, enrollments, contract management, and credentialing? All these becomes very critical. And we look at the reducing cost aspect of it, claims adjudication, payment integrity, or making sure that you are not paying and then chasing to recoup the payments. And all this comes together from a compliance and audit perspective, from a HEDIS reporting and adherence to the audits and compliance standards. Let's move to the next slide, Kevin. So here are a few examples of that we have delivered in the past. And these are definitely some things, some use cases that are near and dear to some of your plans. Like, for example, the AI for eligibility churn and redeterminations. This is one of the key areas of focus where the issues are around how do you cover the losses, drive the care gaps when people drop off, the medication stops or conditions worsen and costs rise. AI helps us to guard that door. Eligibility churn breaks care and revenue. Some of the major challenges that we have seen are coverage losses, ghost capitations, retroactive terminations, and some 834 MMIS mismatches, which have a downstream impact as well. So we have specific AI solutions for some of these specific areas. Like, for example, we can do a churn risk scoring to identify members who are at risks. We can auto-check the documentation, pull income verification and residency details, which can be documented, mismatch households. All these can be done in a very seamless and automated fashion. We can catch duplicates. We can reconcile between the 834 files that we receive and the MMIS, and we can very clearly look at all the outliers, and it can give you a dashboard and an analytical view of the things that you need to very quickly address. What this does from an outcomes perspective is faster verifications, fewer retroactive terminations, higher renewals and retention, because you're able to do the outreach much faster. You're able to engage with the members much faster and quicker. And obviously you'll have a clean roster and payment mechanism as well. Some very measurable business impacts we have seen in this space is very evident decrease in the retroactive terms, decrease in ghost capitation, from anywhere between 0.5% to 2%, decrease in the days to decision making from 50% to 70%, increase in retention from 10 to 20% for at-risk groups. So these are all very clear benefits that we have seen from the work that we have done alongside with Catalyst for some of our clients. Let's go to the next slide, Kevin. So the next use case here is around cost, right? Cost, obviously, you want to make sure that the costs are manageable. Obviously, with a lot of changes happening in the industry, and the whole industry is going through a systemic and a transformative change, it becomes very important that we manage the cost. The goal is very simple for us at healthplans.ai. How do we do as much as possible straight through processing? Fewer pens and fewer appeals. So what do we do is we try to bring all the processes that will look for missing information or anything that we do downstream. We try to really bring them upstream and make sure that we are able to catch them upfront and there is no downstream impact. So like, for example, missing information, or we could put in a filter for fraudulent claims, the complexity of the claim. And then what we could do is we could route them to the different buckets and to different investigation units within the organization to do a retrofitting or do a triage of the claims itself. Claims should be processed accurately the first time. Hence, we score each claim in terms of anomalies, fraud, waste, and abuse. So all this can be done upfront. We don't really need to take the process downstream and then figure out, oh, we're missing this information. Oh, or this is a complex one. Oh, or this is not part of the medical necessity. All that stuff which was done downstream can now be pushed upstream, and everything can be cleaned up as a filter with the use of AI technologies. We can give coders and nurses smart help from a DRG or an APC ambulatory payment classification checks, medical necessities, modifier guidance, quick reading of attachments. How about you send me a PDF file and I can summarize it for you and have a click through for what did attachment summary mean. Very quickly somebody can read it through and make sure that they are lined up to the claim itself. We can resolve the coordination of benefits or the third parties liabilities, entity resolution, who comes first, who comes second from a contract perspective. All that can be done in a very automated fashion today without skimming through the manuals, the pages of manuals which are there, and it never gets updated. So the outcomes that we have seen is, as I mentioned before, more straight-through processing, fewer pens, fewer appeals. Nobody wants to appeal. Obviously it becomes a classic catch-22 there. You want a higher in the first pass, you want a financial accuracy, you want payment integrity, you want to make sure when the payment flows through, it's the right payment the first time, right? And you're not chasing for any recoveries, because it has a direct financial impact on everything that you do downstream. And we have seen that in 2025 with a lot of these national plans who are suffering right now. As I mentioned, recoveries shift from post-pay to prepay prevention. So you don't pay anything you don't have to pay. Then chasing them and collecting them becomes a horrendous task. Some of the very high-level impacts this can provide is very evidently overpayment prevented. Anywhere between 0.5% to 1.5% of medical spend, which is huge when compared to national plans. It can go into millions and sometimes even billions. Increase in detection, fraudulent claims, 2 to 4%. Imagine it's 2% of all the claims, and they are all complex, right? There you go. Your medical loss ratio and your whole, the financials goes for a toss. Straight through processing, you can definitely, by filtering it upfront, you can do a lot of straight through processing, increase from 10% to 20%. Manual touches can be reduced very significantly because you're summarizing, you're providing all the information, you're giving explainability in terms of where did I get this information from. Look at it from a human perspective. Humans also work on a lot of manual information from a standard operating procedure or a training manual, which never gets updated. How about I give you just-in-time information and I give it to you on the screen where you can do exactly what you're supposed to do. And that in itself increases the productivity and efficiency. When you do that, you directly impact the cost. Let's go to the next slide, Kevin. Regulatory and staying compliant, right? This is one area where we believe and we have high conviction here that we are going to move away from audits. We have seen that it is getting proven. I'm sure in the next 12 to 24 months you'll see a significant ramp up in this place in terms of audits, compliance. We move away from doing audits to building compliance in, right? Gone are those days when we had to do quality checks at the back end. Now, how about bringing the quality and building the quality compliance audit measures and mechanisms and controls right through your processes? That's what healthplans.ai endeavors to do. We follow strict guidelines, mandates, CMS rules, regulations. Our approach has been to build compliance into the processes, policies as code, right? I take the policy and I can code the policy dynamically into what I want to check for, timers, audit checks that fire automatically. You can do sampling automatically these days, providing a lot of evidence as a byproduct of doing that work. It shortens the life cycle, lowers the rework, and prevents issues. One classic example that we have seen in 2024 and into 2025 that all of us are working towards is prior authorization, the penalties and abrasion, right? So CMS and the federal regulatory bodies are coming down heavily that we see a lot of talk and hype around prior authorization. And that's a very simple decision that we all can make towards making it very efficient and effective. Some of the AI solutions that we have built in is around data normalization, right? FHIR standards, FHIR mapping, validators, natural language processing, chart abstractions. I can ask by abstracting images, identifiers, and codes from this clinical data and clinical processes, clinical images. I'm able to very quickly summarize and provide and also compare against a whole host of things and provide the most appropriate summary for that particular case itself. A real-time compliance AI, as we do things, it tells you what to do, what not to do, or it flags and it errors for you. It does not move to the next step. Why do I need to move to the next step in the process if my current step is not accurate? So we can do a lot of things today with AI that was probably and possibly impossible even 6 months ago. APIs, we can build in APIs for fire and the 275 traffic that we have. What this does is higher encounter acceptance. So it really changes the game. You can have on-time PA decisions, like the gold carding. If I have a provider who is compliant, who is doing everything as per the policy procedure, and also have some inbuilt rules and dynamically abstracted rules and summaries, I can have a gold card process, wherein as the PA request comes in by any mode whatsoever, I can quickly validate, verify, and get that for approval. Typical impact that we have seen from a business outcome perspective is it increases the encounter acceptance from 10 to 15%. This is all on the conservative side, right? Because obviously every plan is different, and there is no one plan that I have worked in on the last 12 to 24 months that I can say it's a cookie cutter. So they are all different. We can reduce the prior authorization on time, from anywhere between 7 to 10 days that we have seen in the industry to close to hours these days. That's the speed at which AI can do some of these processing, obviously because of the mechanisms and the abstraction that we put up front. Reduce quality abstraction hours by 40 to 60%. AI can abstract, summarize much faster than a human can do today. And if we did a comparison of the human to the abstraction of AI and the quality and the accuracy, the findings were significant, mind-blowing. And of course, at the end of the day, you want to be compliant and you want to have no audit findings, and you obviously don't want to get penalized, because that's the worst outcome that any health plan can have. So those are some of the use cases. We have a bunch of them. We have solved for several of them because the way we do it is very, very different from the others. I can talk a little bit as we go, but now let's talk about, what does a successful AI implementation mean? Let's go to the next slide, Kevin. Thank you. It starts with a focus and a governance, right? And an actionable plan. You always want to start with an actionable plan, pick a few high impact use cases. What do I mean by high impact? Wherein you're going to spend less time, but you're going to have the highest ROI. Like from productivity and efficiency perspective, simple tools like a knowledge AI that we have developed, you ingest the data, information, and imagine as a claim is getting processed or an enrollment is happening for a member, it walks you through. And it tells you this is what needs to be done here, this is what needs to be done here. On the screen, it comes up. That's a very clear, actionable plan, a tool which is very, very low impact. But from a productivity and efficiency perspective, it's got the ROI. You need to have your process flows and data ready. It should be a living knowledge. If you do not have a good handle of your process flows and the data, we have a solution for that as well. We will talk a little bit about the discovery AI tool. You need to manage risks upfront. There are always going to be risks. AI is only a means to an end. To anybody who has implemented systems and solutions, you always need to have a rollback mechanism. You need to go back. So you need to have a mechanism by which you are able to mitigate some of these risks. You want to have compliance measures, even though it is just a simple chatbot. You want to have the compliance measures built into your chatbot or any of your OCR technologies or summarization technologies that you may have. The way we do this, we let the AI do what it's best at doing, and then we stage it. Now, imagine somebody going out there just working on just the staged files, be it claims or be it for payment, just working on everything that the AI has done. It's explained to you where it got the information, how it got the information. It is all within your firewall, your standard operating procedure, your compliance document, your payment document. It has extracted all this information. It tells you clearly, here is a process I went through. I looked at this, and looked at this, and this is what I came as an outcome, but I also don't believe this is accurate. How about that? And the reason it can tell you that it's not accurate is because the CMS mandates, federal regulations has probably changed from the time that the staging has been done to where you're applying the rule for integrity purposes. So that is the level of technology that we can bring in. And the human in the loop then says, okay, let me look at why do you say it's not the best result? And go and click down and say A, B, C, D, E. Wow, it looks good. I'm going to approve it. So that's the stage gate and the toll gate that we put. We don't make decisions. We want to drill that very, very clearly. We don't make decisions. Decisions are left to human in the loop. And the human in the loop is the one that approves or disapproves, so that it's very clearly documented, logged, and there is a proof and verification out there. Obviously, the next step is to pilot some of these use cases. You want to pilot with a few people. And then once you are very comfortable that the pilot is successful, you want to scale that, and you got to put into production and use, push it out into your environment and make sure that there is ROI. We have seen just by working on our platforms and working for some of our clients, we have immediate ROIs anywhere between 30 to 40% is what we have seen in some of these very small use cases, and then you scale from there. So let's talk about a little bit. I did touch upon these two concepts around process and data. In my interactions with folks like yourself, what the common question or theme that I get is, Joseph, I'm not sure about how good my processes are, or whether I have the data. Let's go back to the previous slide, Kevin, sorry. And that is where the discovery AI and the knowledge AI, comes in. If you're not very, if you do not have a process document, if you're not clear that you have insufficient processes, then that is where you start. The discovery AI, it's primarily a tool that is used for process mining, and knowledge AI is to give the staff precise, context-aware answers, right? These two, between these two, you will very quickly see productivity and efficiency really skyrocket. Discovery AI watches the digital footprints across your systems and draws the true map. It can give you variation analysis, time and motion study, who is doing what, who is sitting there and probably twiddling their thumb, or who is looking at process documentations more often, who is skimming through all that. If it is electronically on your laptop or desktop, it can track each and every piece of information, and it gives you a very good footprint of the processes and a map of how people are traveling to meet their tasks and activities. On the other side, the knowledge AI takes that discovery and converts it into knowledge base, saying, okay, I have this SOP, constantly this SOP is being referred, I'm going to bring it up to the top, right? Imagine it's in the 100th page, but you're bringing it to the first page, or dynamically it shifts based on user experience and gives you a point. In point, it gives you on your cursor a particular pop-up message saying, okay, this is what you do here. So combination of the discovery AI and knowledge AI is extremely powerful in some of the use cases that we have seen. Let's move to the next slide. What does a successful AI implementation look like, right? Some of the questions that I generally ask to my clients is some of the things that we already spoke about. Do you have a good understanding of all the processes and workflows in your function? That's a very first step, because the important feed for AI is two things: process and data. Process and data. If you do not have these two, then that's where you start working towards. Do you have a good understanding of your internal processes, your standard operating procedures, your policies? Are they all updated? How synchronized are they? How often are they updated? You need to have a good understanding of this. Do you have the necessary data? Do you know what people are doing? Do you know what process data? Do you know what your error rate is and why people are continuously making these errors? What are they doing? What are the teams doing on any particular day? Who is working on a complex claim? So these are very simple questions from an operations perspective, becomes very important, but most of the time we are not able to answer these questions. That's been my reading of some of the conversations that I've been having. Let's go to the next slide, Kevin. Safety net for health plans, right? That's why we are all here. There are some significant barriers. Like safety net health plans are there to provide a service to a community. That community could have significant constraints, like, for example, it could be housing, food, language, trust, and AI must respect every single one of them. You cannot eliminate any of them. You need to take into consideration. That's what community is all about, right? You need everyone to be part of the community. And our solution impacts very significantly the community health plans. It cuts the waste, not corners, to help people, not replace them. That's our goal at healthplans.ai. And we want to make every model explainable why a decision was made, not necessarily a decision, why a processing happened a particular way versus some other way, versus some other branching. It gives you explainability into every step, every process, every task. Building in fairness, adjust for risk, keep human review and keep human in the loop at all interactions. What that eventually does is leads to everything that we spoke on top around the goals that SAS was mentioning, around member engagement, provider satisfaction, cost reduction, keep the compliance in check. So when we do all these things, it doesn't have to be piecemeal. It can be all coordinated and collectively and collaborated. You will have a better experience. And at the end of the day, it's a speed to value. Next slide, please. SAS, I'll turn it over to you.
Sure. Thank you, Joseph. That was very helpful. Having gone through, and there's a lot of mistakes we made, and we learned a lot. So over the past year and a half, we've learned a lot going through this. Let me maybe take this is obviously a very small sampling of what we learned. Joseph mentioned this briefly, but we always had a human in the loop in any of our AI projects. So, think of AI as a very smart, knowledgeable, diligent intern who does the heavy lifting, but ultimately a human expert is pushing the final button or taking the business decision. This was a non-negotiable from the very beginning. Would we change that at some point? Probably. but we did not want to start without having that human in the loop. And the benefit of that is also if AI actually recommended something that the human disagreed with, that went into the learning cycle. So the AI would not make that recommendation again. The few other sort of governance related things were business driven, right? Given the urgency of the situation, we can't afford to spend time with a new toy, right? It has to deliver tangible business benefits. Just as any of our other transformation levers, AI is also a means to the business benefits end. So our learning was that business operation-led AI initiatives are more successful. And most of our, I cannot even think of, I mean, there are some IT-led projects, where IT help desk or, things like that within the IT support organization, that were led by IT, but otherwise we were, business-led, obviously supported by different experts. Speed was another one that I would, like to emphasize on. It's a really important need, right? I know it may not be inherent to our industry, but most of our AI projects have been run with a sense of real urgency, with 6 to 8 weeks of agile, rapid runs. And if it didn't work, we wanted it to fail fast and move on to the next one to see benefits in a short period of time. Complementary skills, I think I brought up some of this. What we learned is that the key to AI success is in the use case, the industry knowledge, the data to train the agents. So it was such more expedient and lower risk to engage a reliable and expert partner, in our case, obviously healthplans.ai, to work in partnership with us. So what that really did is we didn't have a learning curve of our internal folks having to learn AI, or what we brought to the table was our 26 years of experience, subject matter experts, people that know US healthcare, Medicaid, Medicare really, really well. And instead of trying to teach them how to do AI, we brought in an expert that actually, build the solutions for us. But then they were tested by the expert. So, think about it as, you're bringing on a new employee and you're training them. The one last thought is that we also ran into a lot of AI companies with point solutions. One that does this little tiny automation or thing. What we learned is that a partner who can really stitch together these islands of AI solutions into an orchestration of improvement of entire business functions, delivered way more benefits, right? Because and it's a proliferation of all these agents. We don't know how they work with each other and all that. So that's where you heard what Joseph talked about. These were functional solutions. These spanned across a business function. And we were transparent to what building blocks, what small AI solutions, agents, whatever they were doing in the back end, working with each other. We were concerned about the ultimate outcomes of the entire process. I mean, I could share a lot more, but in the interest of time, those are the few I would talk about. Move to the next slide, Kevin. Again, I know we threw a lot at you, so are you confused yet? Wondering where to start? I was faced with the same when we started, right? My humble recommendation would be to start with the discovery agent. It's a low commitment, non-invasive way to gain detailed understanding of your processes, productivity of your staff, control deficiencies, and it's intuitive and provides visual insights into how your operation is run today. This was a question I bet many of you have, that I had real difficulty getting complete view, not just at a high level, but getting down to individual employees and how they are performing. Is there is some help they need? So even if you decide to not implement an AI solution, there are plenty of improvement opportunities that would come to light to work on. I mean, it did for us, right? There were issues with standard operating procedures. There were issues with training, which we didn't need an AI solution. It was just simply that visibility, allowed our operation to go improve those. Also, if you decide to move forward with an AI solution, the exact improvement and the quantification of benefits would be determined upfront to avoid any disappointment later, right? So this is, again, we were not going to invest in something that was not going to give us a benefit, and we're very ROI focused, so we wanted to make sure that we actually had a sense of the quantification of benefits, tangible benefits, not just cost avoidance or something like that, before we took on implementing an AI solution. And the discovery agent, really gave us those insights. Moving from that, I think the knowledge AI and the co-browsing AI are ways to handhold and guide staff in their day-to-day work to reduce errors as well as drive productivity. I kind of refer to these as no regret steps to really dip your toe into AI with guaranteed benefits. At least that's how we went about it. And we've clearly seen a lot of tangible benefits from this. I mean, we've gone way beyond this now, but this is sort of where we started. So I know we have some time left for questions. Given how much I liked Discovery Agent and I did not know what it could do till I tried it, we've twisted Health Plans AI's hands to provide a free Discovery Agent assessment for the participants of this webinar, so that you can actually test it out yourself and see how it works. Again, no regret. There's no strings attached. There's nothing. I mean, and this is exactly what I went through myself. So that's why we've insisted on Health Plans AI to offer this to everyone that's attending today, so you can test it out for yourself. I'll pause for a second if you wanted to scan. We'll send the presentation out as well, so you can do that later also. Move to the next page. Yeah, we have some further reading on AI. I mean, there is an upcoming podcast by Health Plans AI. We have an AI blog. We want to make sure that we are sharing our experience and knowledge, and also where we are going next. We want to hear from you. We want to understand what your experiences are. So please do join us on these. And there's a lot of introductory things that we are presenting also. I mean, where there are costly courses that people go take, because we've gone through this. We're offering that. Health Plans AI is offering that, and I know we have some time left for questions, about 10 minutes. So we'd open it up to any questions. We'll try to take as many as possible. This is not the only opportunity. Feel free to reach out to me as a peer. If you wanted to hear about my experience, where did we start, where did we go next, what didn't work, I'd be happy to do that. Joseph would have a lot of answers around how how far we have come in terms of AI technology. It's changing by the day, but we're happy to take any questions.
So I've been keeping an eye on the Q&A. One of the questions that came up, and by the way, you can continue to put your questions in with the Q&A button at the bottom. One of the questions is, for SAS is, how can operations leaders identify which processes are best suited for AI solutions?
Yeah, $1 million question, right? This is exactly where we started as well. There are so many things that needs to be improved, but what gives you the biggest bang for your buck? Where do you start? And we had some ideas in terms of where the issues were. We went through a process where I actually, asked in our town hall meetings and employee, all hands, for all employees to send us, kind of snippets of what in their day is the most difficult to do, is the most error prone, takes the longest amount of time. And that gave us sort of a 360-degree view of what was going on and where we may be able to drive the biggest impacts. However, it really got solidified and quantified when we ran the Discovery AI, because it actually came back. I mean, the results of that are very specific, right? Here is a use case, or here is an improvement opportunity, and this is the quantified benefit that you could get from that opportunity. So that's why I actually suggested, doing that. I mean, there may be some basic no regret things that you do, like we had some issues with our fax inputs and call centers, things like that, which were, I mean, kind of slam dunk. We did those, but the true strategic larger benefit initiatives is best to do that after you go through a discovery agent review.
Okay. Another question, what risks should plans be watching out for as we scale AI solutions? And to kind of follow up with that, how do we mitigate those risks?
Joseph, you want to take a first stab and I can go next?
Yeah, so thank you, SAS, for that. How do we mitigate those risks, right? I mean, I had a slide on what is a successful implementation. If you flip that coin, every single thing that you don't do there are all risks. Let me give you a simple example of errors on high impact decisions, or biasness being introduced, disparities. There can be model drifts, right? You might tune for one model, but then you're drifting away completely. There could be PHI, PII constraints. That could be, like, for example, claims with prompt pay. If you're not capturing some of these things, you miss the appeals clock and all that stuff. So the best way to do is to have a good understanding of the process. What are you trying to accomplish? What is your mitigation plan? What is your governance mechanism? What is your risk strategies, and how you're going to address them in the event that this happens? You might still encounter something new, but that's something new, right? Because you know what is to be done from a known risk perspective. So once you have a good arm around that, and you do I mean, enough amount of testing in your environment, I think you should be very successful and should be covered to roll it out into production.
What I would add is, like I think I mentioned, right? I consider AI as an intern. So AI doesn't push any final buttons. AI doesn't, it assists in decision making, but it does not make decisions. So you always have a human in the loop. That's one way that's a risk, if AI were to just go take decisions on its own. But if you have a human in the loop, you have mitigated that. So think of AI as that intern, right? So some of the same risks you have when you bring on a new employee, you're going to actually have the same types of risk with AI. They're not that different. I'm talking about, you have a secure infrastructure and all of that, right? So which you have to have anyway. So if you approach it that way, I think the risks are quite controlled.
Okay. We have another question here. Can you shed some light on your efforts around predictive analytics capabilities by leveraging and combining data from both back office and front office processes, knowledge, and systems?
Sure, I'll take that question. So one of the things that we do very well is there are different kinds of data. The most important aspect of any data is what is the context behind the data. And today's technologies are very good at figuring out the context behind a particular data element and what the data element will do for you from a larger process perspective, from a grand scheme of things, right? So what we do is, for everything that we do, as I mentioned, we have logs and all that stuff. These logs are brought upfront in forms of dashboards, in terms of analytics that we can parallelly, and we do it today for some of our clients. Like, data is coming through, you scrape that information, and you're able to quickly we had done this for a client where we were doing fraud, waste, and abuse, and because we build those processes into our into our AI, you're able to very quickly say, hey, we have captured these two, but that could be something else here from a data perspective that we see in the analytics, and we're able to present that in a dashboard. Several use cases that we can introduce from a data analytics perspective.
Yeah. Very good question. It's a vast topic. I'll just scratch the surface a little bit. And this is sort of where we go from, claims processing or a transactional process to, something you probably heard us talk about, MLR reduction and things like that. And the way we approach that is, analyzing claims data, analyzing some of the enrollment data. We're able to come up with some predictive interventions in terms of, someone who's a frequent flyer to the ER, or cardiac health, cardiac failure, patient, right? Where if you see their weight, gain, then there is something going on. I mean, there's a multitude of scenarios like that, where now we are able to actually match and throw that data against each other to come up with some proactive interventions. That's a topic for another completely different webinar, but very good question.
Mm-hmm. Last one, we'll quickly get this one in, is what level of IT infrastructure investment is typically needed to support AI?
I'll take that question as well. That's a very good question. It depends. The short answer is it depends. Now, if you are talking about a discovery AI or a knowledge AI or any of that tools that we have in our arsenal, it is very lightweight. It's available via a desktop widget or as a Chrome plugin. We can enable any of these tools out there. But now, if we are going to talk about claims, enrollment, you're talking about prior authorization, that's a different topic by itself. And we have different model out there. We can put this AI solutions on your VPC, which is a virtual private cloud, or we could run the operations, basically connect into your existing applications, and it just routes through our technology and comes back and processes that. So there are multiple ways of doing this. If there's any specific questions around other tools, technologies, happy to take them, address them. But specifically from discovery, knowledge, or a co-browsing perspective, it's very lightweight. Whatever infrastructure that you have there today in your environment is good enough for us.
And that does it, because I know we're at the top of the hour now.
Thank you, everyone.
Thank you all.
Yeah, appreciate your time and questions. Look forward to, we'll send you the presentation. Look forward to your comments and feedback back from, the Discovery AI assessment and what you found useful or what you were able to find through that Discovery agent. So thank you very much.
Okay, thanks a lot. And I'd like to thank all the attendees for joining us today. And thanks Sass and Joseph for a very informative webinar. Just a reminder that the slide deck and recording will be posted on the ACAP website by tomorrow morning. So thanks again and stay safe.
Thank you.
Thank you.